my story really is just to go back to the beginning, how it all started, and to give you one case study. There's always that one patient that you've just got to start with. You're going to have a bit of confidence and kind of know what you're on about, and just be willing to dip your toe in the water, forgive the pun. So I came across laser by accident, really, and it all goes back to the beginning of the pandemic. When it all kicked off and started, there was a whole hubbub around steroid injections, right? So most of my work is injection based one way or another, whether it's NHS or private. I tend to get the really horrible, chronic-y, long-term type of ones. So steroid injections became an issue because of the risk to the immune system, blah blah blah, whatever your thoughts are on it. And at the trust that I worked at, there was pretty much a ban. A complete ban on steroid injections, and of course going through that and looking at the evidence and research with the orthopedic chaps and whatnot, of course took what I found there across to private practice. And so I decided for the first probably 6 months of it not to do any steroid injections if I could at all help it. But then the question of course was, well, what can I do other than the usual orthotics and stuff like that. So that's when I knew Steve and the guys had laser. And I'd been playing around looking at shockwave and laser and looking at the evidence and research behind it for probably a year before that, trying to figure out what would be the next gadget to buy. I'd had experience with shockwave in that I'd referred a lot of patients for it, but I wasn't really getting very good feedback from it, and a lot of patients were having multiple treatments and sessions, and it just didn't quite do what I was expecting it to do. I didn't have my own version, so I can't comment directly. It was just secondhand information from patients who tried it. So essentially with the laser, it's now 12. How long have I had it, Steve? About 15 months, I think, isn't it? 12 months, 15 months maybe. So I've done a lot of work with it in that time, and I have to be honest and tell you straight, it has absolutely completely changed my practice. I do a lot less injections as a result of it. So the initial case, the first case that I had was a lady aged around 56 who's a florist, so sort of slight to medium build, and she had one of those absolutely rip-roaring inflamed heels, the type that you see where there's just fullness and thickening of the whole heel. It just feels very turgid. It's exquisitely tender and painful to palpate it. Luckily, I have ultrasound in the clinic, so I generally scan a lot of them. And we found that there was some subcutaneous thickening there, and the plantar fascia itself was way in excess of 8-point-something millimeters, and there was severe vascularity all over it, and this was really a huge problem for her, but she'd managed with it for several months anyway, so there's no immediate urgency. But typically on any other given day, I would have gone straight for a steroid injection, because I know for me it will be a one-off. It'll likely improve the symptoms up to 80% within a week or two, and despite what you think about it, that's kind of what we do. So with this lady, I'd only just received the laser machine. I just kind of knew there's presets on it. I think I can figure it out as I go along. Flick the switch and set it up on the plantar fascia setting. I used the handheld probe. So the only thing that I wanted to make sure of is whatever I was going to do, and I signed her up for a course of 4 to 6 treatments. I said, look, I really don't know, but if you're happy to go along with me, there's very little else we can do at the minute. And worst case scenario, if you're really unhappy at the end of it all, I'll give you your money back, because I need to just test it and see. So we had a bit of an agreement, understanding, consented for the process, and I was really, really dubious. I didn't think it was going to even touch the sides whatsoever with this huge heel. So I had backup plans. I was going to put her into a walker boot and do all sorts of other stuff to offload it. But I thought, okay, let's do the basics. So I gave her the simple insole. She wasn't particularly overpronated. The biomechanics was fairly unremarkable, other than this rip-roaring heel. So we started with the plantar fascia setting, and I did 2 cycles on that setting. I can't remember all the details of it. I haven't got it in front of me, I'm afraid. Perhaps some of the other guys can fill you in on the wavelengths and whatnot of the plantar fascia setting. And the way I used it was, I didn't use the Charlie head. I didn't really hadn't really figured out how to use the Charlie head well. All I knew was I wanted to have maximum contact with the patient around that heel. So bearing in mind it's incredibly sensitive, so I could go very light. But essentially, if that's the ball of your heel here, and then we're going into the arch. So I placed the probe pretty centrally to start with. And so I started very centrally, allowed several seconds, maybe 10, 15 seconds in that position. And then I just created a small winding circle. And then I moved over to the medial calcaneal tubercle, so slightly more medial. And I carried on this process for a couple of minutes. When I felt I'd done enough, as much as I needed to there, probably 2-3 minutes later, I started to move up just anterior, just off the edge of the calcaneum, and coming up to sort of the mid portion of the plantar fascia, and just stroking it along. So I kind of go from the fasciitis right at the back of the calc, and then just stroking along, and we just use that very gentle touch, you know. So that was the protocol. So first treatment, we did it. Felt kind of good at the end of it. I thought, yeah, I think I've got the hang of this. Got it back. The protocol was 2 treatments in the first week, 2 treatments in the second week, and the idea was we'd just evaluate and see how we went along. So after the first treatment, she came back and pretty much nothing happened. She hadn't noticed any improvement. She hadn't noticed any difference whatsoever. The heel looked to me pretty much the same on ultrasound. The difference was I was measuring as we went along with ultrasound. After the second treatment, there was an improvement. There was suddenly, she was feeling a bit of a difference. Looked at it on ultrasound. Didn't look much different on the plantar fascia itself, but physically I could feel and see that the heel had eased. It wasn't so turgid. It wasn't so sort of full feeling, and it was a lot less sensitive than it was initially, you know, where I could really barely put a finger touch on her without her, you know, kind of jumping through the ceiling. So second treatment worked quite well, and then it just progressed from there. Third treatment, she came back the following week. It was further improvement, and the fourth improvement, and I was scanning all along the way. And after the third treatment, that's when we started to see the changes on ultrasound on the plantar fascia. It started to reduce in thickness. So altogether, it's quite a long story short. We went up to do a course of 6 treatments, and the patient was just chuffed a bit so the whole way through. She really felt the benefit of it immediately after the treatment, and then for several days afterwards. And then by the time you know, symptoms were just starting to recur, she was back over again. So with the total of 6 treatments, bearing in mind the plantar fascia was 8.3 at the initial stage, with a little bit of vascularity in there. By the time we'd done the 6th session, she was down to measuring 5.3 millimeters on the ultrasound of the plantar fascia. So there was a clear difference after 6 treatments. She was happy with it. Although the plantar fascia hadn't completely reduced, I would have liked it to have been about 5 mil, maybe 4 or under. But she was more than happy with the improvement. She was walking around. She was doing what she needed to do. She was working and able to spend as long as she needed to on her feet. So sonographically, it looked probably about, I don't know what, 60%, 40-50% better than it was when we started. But the clinical symptoms had improved probably at least 80%, if not a bit more. Such to the extent that we left her on a SOS, and then we telephone reviewed her 2 weeks after as well, after the 6th treatment, and she was still chuffed to bits and she was happy with it. So I thought to myself, look, well, plantar fascia is a really tough thing to treat, I think, you know, with all sorts of treatments conservatively. It's, you know, you've got to get through that deep fat pad in the heel, and you've got to get pretty deep in there, close to the bone to really get to it. So really was dubious about it. But now having done that one, and subsequently now I think I've done at least 10 or 15 plantar fascias where, you know, more than likely would have had an injection otherwise. They've all done really well. I can't think of one that's not improved, but I have had a few cases who've complained a few days afterwards that they've had an increase in symptoms, an increase in pain. So I've had a few cases like that where they've reported symptoms afterwards, but generally speaking, on the whole, 80-90% of stuff, you know, peroneal tendons, Achilles tendon, this, that, and the other, you know, we had it as part and parcel of the treatment, or that is the treatment full stop. And touch wood, thus far, I can't really say there's any cases that haven't got better other than the couple that I mentioned. So good stuff.